All right. So we have more people who are joining on. Um, at this point, I do want to get started. I'm going to introduce myself, but just as a quick thought, Tiffany, I heard every bit of what you were saying,
Mm-hmm.
and I actually can connect you to a wealth of tutors who have banded together, and they actually are students, um, you know, various levels of whether they're upperclassmen or beyond, out of the University of Rochester. So if you would
Great.
like to get names of those individuals and their fields of studies and schedules, et cetera, I am more than happy to pass that
Yes,
information on.
definitely.
All right. Well, good afternoon, everyone. I know it's the beginning of the afternoon, and I'm so glad you are deciding to spend it here with us today. I am Yasmin Maddox. I am the founder and CEO of a company called Architect, where we create web based professional advancement tools for working parents. As of late, and I'll say as of late means pretty much the year since the middle of March, if not late March, our attention has pivoted, admittedly, to really focusing not so much on professional development as it concerns working parents, but how we can support childcare providers. And so that is why Pathstone Enterprise Center and Architect have joined forces to provide this webinar series to you, so that we can provide you with the information, resources, and in the case of passing on referrals to talent to help you all as childcare providers navigate really an uncertain and trying time, certainly as we go into the fall. Please, if you have any questions, don't be shy. Feel free to pipe up and ask them, or you can also feel free to type them in the chat box, and I will get to you as soon as I see it. All right. So this is our first webinar. There's a lot of information, but I am going to try to keep the best pace possible so that I get it all to you. Now, I'm just going to zero in on the agenda for a moment. As you can hopefully see, there are 3 sections with double asterisks. I emphasize those sections because really they are the most important. There are about 40 slides in this presentation deck. We may not get to each and every one of those slides. The slides that we do get to, I'm getting to because they are the most important, and you can get the other slides that I do not speak to directly. You can just read those in your free time. All right. So section 1 is really on using technology to become more organized. Much has been said about technology, especially about software, about how we're in an age of software and how that's important. But oftentimes it's not indicated why that's important. And so I'm going to give that information to you right now. As far as you are concerned as a child care provider, using technology to help you organize is central for a few key reasons. And this is, regardless of whether you're in a pandemic or not, but because we are in a pandemic, it's all the more important and true now. So the areas where it's important to be most organized as a child care provider are your client records, your information and data, your operations records, so information and data and finances, your COVID-19 operations and public health checklists, which if you don't have any yet, don't freak out. We will help you with that. Calendaring, which perhaps is the biggest of them all for the reasons I will go into, and school year logistics for the families you serve, as well as the families you hope to serve, so prospective clients, to use that term. So the benefits of digital calendaring really quickly. For a child care provider, really it allows you to see all of your chronological business activity. Oftentimes there are cases, and this is speaking from personal experience of working with child care providers, where there is an inconsistency in how your calendar is set up. There's a hodgepodge. You may not have what we call a master schedule or scheduler who handles those matters. For your current clients and families, A digital calendar helps you so that your clients can know when you're operating and not, and what capacity you have to provide care based on your schedule and any open calendar slots. Prior to COVID, that was important, surely. But now, especially because we are going into the beginning of a school year that we already know is going to look fundamentally different with hybrid models. So, a couple of days in-person instruction here, a couple of other days or the remaining week remote learning. It's going to be that much more critical for current clients to understand what availability you have, and not only on account of you want to be open on a certain day at a certain time, but if you are allowed to, based on what's going on health-wise in terms of yourself, your staff, those who you serve. The same can be said about prospective clients and families. As you can probably imagine, parents right now are starting an incredible rat race, to use that term, and I am among those parents, to figure out, okay, based on my schedule, based on my partner or my spouses or whomever is in my support network, based on those individual schedules in addition to mine, where am I going to need help? Where am I going to need support? What childcare provider has made it exceedingly easy for me to identify that they are the right one to provide that support? The easiest way to do that is to have a calendar that is easily accessible and that is digital, for instance, on your website. Vendors. Together, you and vendors can schedule meetings and more efficiently conduct business. This could include wholesale food deals, furniture transactions if needed, and more. One thing that we'll get into a bit further, but I will bring top of mind right now, is the fact that I don't think anybody, myself included, wants us to experience another catastrophe, which was the beginning of this pandemic, when nobody could find toilet paper for a few critical weeks. I'm sure some of us can look back on that and laugh at this point, but I bring that up in part in jest, but in part in seriousness, to say, if this fall presents us with an uptick in COVID cases, or even the look of an uptick in COVID cases, at least initially, because it's also going to be the beginning of flu season, people are already hardwired to load up, to use that term, on cleaning supplies in the fall, right? We get cleaning supplies, we clean, we tidy up for the holidays, etc. You are going to want to know who you can work with, who can work with you to source cleaning supplies among other supplies. And so for right now, I would like you to think about whether it would make sense to you and whether you would appreciate and attend a webinar and any offerings that will help you, source and understand what cleaning supplies are best. If that sounds like something good to you, please let me know in the chat, either directly or to everyone, and there will be a poll to follow as well. So for vendors, a digital, an online calendar is important. For advocates and stakeholders, the day-to-day business of many of you as childcare providers is that really your head is down. You're focused on what you need to focus on, which is caring for children, right? Easily one of the most important roles there is to care for people, and particularly to care for children. So it wouldn't be shocking if you don't also have on your calendar actual dates and times of opportunities to consult with people who will advocate on your behalf, which includes advocates and stakeholders. A stakeholder can range. A stakeholder can be a parent, so a client or a customer of yours. A stakeholder can be an elected official. A stakeholder could certainly be, and as of late actually is, an employer. Employers are finding out more and more just how important you are, as if we did not already know that. And so this is an opportunity like no other to reach out to different types of stakeholders as the ones mentioned and literally get them on your calendar to speak, to see how, you could work together to make a situation a win-win for everyone. So all of this can be done really by having an online calendar. And you can do this with Google, which is free at the base service. Or you could also get G Suite, which has, I think, a cost of maybe $10 or $12 a month per user. So again, and now we're going to get into the heart of it. What needs to be organized as a child care provider? A couple slides back, I had shown, I think, 5 areas. And I had mentioned to you, I forewarned you that I'm going to go lightning fast, perhaps more reasonably than lightning fast, but I'm going to go through this quickly. So, we don't take up any more of your time on a beautiful Saturday as needed. Needs assessment and calendaring, COVID-19 public health considerations and checklists, and school year logistics for the families you serve. Now, the calendaring is meant to put into focus the fact that you have to be organized, okay? You have to be organized in a way that you perhaps have never been organized before. But you also need to do a needs assessment. If you're not familiar with the term needs assessment or oftentimes where they occur, oftentimes you find that they occur in social services, in the administration of mental health services, social services, et cetera, so that really you as a provider can understand, okay, it's not what I think my clients and my client families need. It's what they're telling me they need and how I interpret that based on the skill set that I and my staff have. So we'll start there. Processes are key. For the needs assessment portion, you want to conduct a needs assessment for your current and prospective families. What do their schedules look like? What do their households look like? At a certain point in this exercise, you should know, and not literally during this webinar, but certainly 2 weeks from now, and we'll help you with it. You should know not only who the main decision maker is in a particular household, but if there are any other people who are critically important to that decision maker or making their decisions. So is it a single parent household? Is it a 2-parent household? Is it a multi-generation household where perhaps the considerations of an elderly parent or grandparent are front and center, and whereas a particular family may not have needed your assistance 5 days a week before all of this started, because they don't want to rely on an elderly relative to provide care, they may rely on you more now than ever. And so to understand those nuances and the particulars of what people's lives look like on a daily basis and how you can support them, you need to conduct a needs assessment, which we'll go through. For COVID-19 public health considerations and checklists, 1, what are they? What do they look like? How can you use that to your benefit? And most directly, with which minimum state and county, as well as local directive, must you comply? That's going to be your ultimate guideline and your ultimate, lamppost, to use that term. What do you have to do? And then once you've figured out what you have to do, you exceed that. Going beyond that, what policies should you deploy based on your business's needs? And then ultimately, with regard to school year logistics for the families you serve, like I mentioned before, what does a day in the life of your client families look like? Where do you fit in? How can you help, perhaps in innovative ways? And to use the term, sky is the limit, and not even that these days. If you get an idea, okay, that just pops up in your head and you think, you know what, this may work, but no, it seems so crazy out of left field, write it down and speak to somebody you trust about it. Guaranteed, I wouldn't say with any certainty a certain percentage, but a good enough number of what are seemingly the most crazy ideas are the winners. So think innovatively about how you can support parents and families. So needs assessment. I am going to pull up one that I've drafted. And for those of you who would like this or who would like a template that's very much like this, and we can work together to tailor it to your particular business, please indicate so in the chat by just saying needs assessment, and I'll know what that means. So with the needs assessment, you're just going to ask for basic information, right? What's your full name? What is your child or children's name or names? Your phone number, right? You, of course, need to know how to communicate with your clients, and you need to know not anonymously what these needs are. In some cases, anonymous surveys are meaningful. In other cases, you absolutely need to know who is who. How many of the children are enrolled in school for the fall? So you also need to know, and very quickly, might I add, out of the families who typically would send children to school, especially those who are in the younger, grades, do they still plan to do that? There are so many people, and I'm taking off right now my business owner hat and putting on my parent hat, which admittedly never comes off. There are so many parents that I've spoken to in the last day who have said, you know what? A few days ago, we didn't know what we were going to do, but every day things keep on changing. But if nothing else, I know that I am going to need more support from a child care provider. And I've never worked with any child care provider. How can I figure out how to make this work, how to get my needs met? This is how you help people do that, by conducting these types of surveys, which take no more than a few minutes. You also want to know, if you didn't know previously, what school district do your clients, their families reside in? Because then you can start to piece together a bigger puzzle of where is there the greatest need? And by finding out where the greatest need is, you could also then think about how you're going to, again, get stakeholders on your calendar to figure out how you can help each other. So if there is a concentration of people who have a need, for instance, in East Irondequoit or in city of Rochester or wherever else, you want to know what that looks like. Additionally, you want to know what people's workday looks like. You want to know if people who have significant others or spouses work standard business hours or work shifts, because then you may see that you can innovate in a space to provide bridge care, right? Or gap coverage, as some people refer to it, in terms of, okay, what can my childcare business do to better support people where they need it? So not only is it a matter of doing the right thing at a time when the right thing absolutely needs to happen, it's also a matter of thinking strategically as a business owner in ways that can expand your offerings and make you more sustainable. Part of the needs assessment, which isn't always advisable to be in a survey, but certainly as a matter of just speaking to people, is really understanding what the children in your care are going through. Without going into too much detail, I am the mother of three children, 3 daughters, and one of my daughters had a really rough time with the abrupt isolation that came with the school closures. And so how are you going to support children through your skill set? If terms like trauma-informed care or trauma-informed school strategies don't sound familiar to you yet, then please take a little bit of time to read up on them. And when you get this presentation, you'll also get the link to this. And it provides really, really insightful and easy to implement tools and tips to really adopt a mindset of empathy in a way perhaps you haven't done before, and to really have a keener eye on what trauma may look like on a day-to-day basis among the children in your care, so they can provide better care, and in turn you can have a better experience in operating your business that is rooted really in empathy and rooted in knowledge of likely what's going on with some children who have been negatively impacted by the last few months, and understandably so. It's been a rough time. Calendaring, okay? Calendaring, and you can see my own calendar right here, but everything should be here for you to see. Now, what I have included, and again, you'll get this too, is how you can do multiple calendars and add them and remove them for different groups, different client or customer segments based on need. And it'll help you really ultimately put together a master schedule. So ultimately, the note here is when you're doing all of this, when you're doing these needs assessments, understanding trauma-informed care and the like, and getting all of these good things on your calendar, don't forget to include advocacy events as well as professional development events, because not only do they pay off in spades for you as an individual on a professional and personal level, but you can actually use that to market your services to say, I have gone to this professional development event and this one, and I have these certifications, and I have experience doing this in X, Y, and Z. And bit by bit, you start to put together really a repertoire, to use that term, of skills that you can brag about and really be proud of and market. School year logistics for the families you serve. Okay. So the school year is going to be, suffice it to say, stressful in many ways, okay? So I want to zero in on just the last couple of questions here on this needs assessment. The question about if you have children who are enrolled in school for the fall, do you anticipate needing more child care coverage than last year? One of the reasons why you're asking this, beyond knowing if you need to shore up your own resources to provide care, is because you want to get some kind of historical record, a comparison, if you will, to see, okay, what are the trends going on? Obviously, last year was not a pandemic, but what does it look like? You want to find as many trends and data points to extrapolate trends as possible, because this will help you really fine-tune your services and your offerings. And of course, if you have children who are enrolled in school for the fall, how many additional hours do you anticipate needing more child care coverage? So you need to get this information, you need to get it quickly, because a lot of people are looking for the same thing. A lot of people are looking for child care, but the coverage that they're seeking out is not always the same. And so that is part of the logistics involved in figuring out how you're going to pull this off. Now, one thing I want to zero in on, and time will not allow me to do this directly with one person in particular, but I can answer any questions if anybody has any questions on top of mine. But something that I've been doing with my family, and something that an increasing number of parents are doing, really, are mapping out or doing family decision trees. A decision tree, as you can see here, can look a number of ways, but in this particular case, it's very structured. There's really like a call and response, or a question and answer method to this madness, so to speak. And before I go any further, one thing that I would suggest to you, and if you would like for these alerts, you can just put in the chat, I would like alerts, is to get automated alerts to your email and to your phone on a daily basis. Oftentimes they come first thing in the morning, so that you understand what's going on, not only nationally, but at the state and local levels with respect to COVID. Johns Hopkins, one of the most preeminent research universities in the world, does this for free, and it's very useful information, especially because of your line of work. So as you can see here, okay, and this is I'm going through my own life, my own rundown. As you can see here, my husband and I need to figure out very quickly and very easily where our children are going to be at any given moment, right? Seems pretty basic as a parent. But because we have different schedules, it becomes all the more important. So considerations that parents are having include, if one of us, or if it's a single parent household, do you work a shift job? If you work a shift job, what's your shift? If you have more than one child, where is each child supposed to be at any given moment? If you have a lot of permutations, or if your clients have a lot of permutations, you need to know that information almost like the back of your hand, because the more that you know about the particulars of their daily lives, the more equipped you are to help them. So you want to set up your own type of tree, decision tree, for your offerings and for the way that you schedule your own business as far as it concerns any tweaks based on COVID. Now, you can ask parents to do this on their own. You can ask to do this with them. It depends on how much rapport you have with the families whose children are in your care. But ultimately, you want a bird's eye view, to use that term, of what each of your client families' decision-making process looks like. You want to assume as little as possible and ask as much as possible within, the appropriate boundaries. And then when you have that information, you can start to look at themes as to, okay, well, I knew that a lot of client families work in healthcare, but I didn't know that the majority of them work this particular shift. I wonder if we can, bring in somebody to provide this type of resource or this type of tutoring. So you want to think of different ways that you can innovate in perhaps small ways, but meaningful ways based on the fact that there are a lot of moving parts. So once you understand the particulars of what your client family's decision trees look like, you can put together your own. Now, client records, including information and data. I'm just going to quickly go through what you should already have and then zero in on what you should really be focusing on in the fall. Care agreements. This is central. A lot of people the past few days have been talking about waivers, legal waivers in terms of COVID in particular. My advice to you, if you do not have legal counsel already, reach out to, as a starting point, reach out to an organization called Volunteer Legal Services Project. They are based right here in Monroe County, in Rochester to be specific, and they help business owners with legal matters, with questions. So reach out to Volunteer Legal Services Project. A close partner of theirs is none other than the RIT, Center for Urban Entrepreneurship. So you can reach out to both of those organizations to get information on whether your current care agreements hold up to the realities of the day. Are there any waivers? Is there any particular language or clauses that should be in there now because of the pandemic? Are there any clauses that perhaps do not fit because of the pandemic? So you really want to reassess what your care agreements look like. You want to make sure that you have healthcare proxies and medical release forms. And if you are authorized by the state of New York, or if you're not in New York, whatever state you're in, if you are authorized to administer medication, you want to make sure that your medication administration records, your MARs, your MARs, are absolutely pristine and together. Now, it goes without saying that this advice is relevant for any time, but certainly in the midst of a pandemic, your ability to capture and organize medical records and information is going to be that much more critical to ensuring that you protect yourself as a business owner and you protect your business in the event that something were to happen. Photography releases, videography releases, of course, you need to have those captured perhaps in a Google folder or a Dropbox, et cetera, whatever suits your needs most. And then government assistance program forms. So right now, even though the past few weeks there have been issues with like a bottlenecking effect with people getting the resources and the aid that they need, there are a number of programs to help you, government assistance programs. So you want to make sure that you have all of those forms together and that you can recall them quickly. Operations records include, if relevant to your particular business structure, articles of incorporation, insurance paperwork, accounts receivable and payable records, training and personnel information and files, which to zero in there are going to be especially important come the fall. Not only because they are always important, but because if you as a business owner and as an employer are going to take on the role really in some form or other as educator, you're going to need to have the documentation to back you up that you are an appropriate person to take that role on. Even though it may feel like you're being pushed into it, you're still going to be in that role to some extent. So do you have training? Have you consulted your local county health department, your local community college, et cetera, to see what, if any, professional development trainings are available in certain areas? Have you reached out to Pathstone? Have you reached out to partnering organizations to see what trainings exist specifically, as well as in other areas, but specifically related to education and, as I mentioned before, trauma-informed care where appropriate, and tax returns, because oftentimes, as you may already have familiarity with it, if you are going to be applying for any type of loan or sometimes even grants, you are going to need to have your tax returns and information handy. So financial needs, right? Money makes the world go round, right? You have to have some kind of financial solvency to really thrive, not only survive in this environment, but thrive. So you have to understand what your financial needs are. Ralph Waldo Emerson said pretty keenly, money often costs too much. So oftentimes, one of the biggest pains or pain points for business owners, including childcare providers, is that you know that you need a certain amount of money, or you think you need a certain amount of money, but you haven't really followed through with understanding what are all of the line items, not only that you think you need or know you need, but that you may also need as a contingency, as a backup. And so there are tools, there are resources to help you really with that thought process. The Provider Cost of Quality Calculator is a tool provided by the government to help you understand how much money you need to make relative to the children in your care in order to provide a quality child care environment. So again, before COVID, quality child care was important, but now it's exponentially more important for the simple fact that, among other things, prices are rising for food, for supplies, in some cases, materials that you may need, rent, whatever the case may be. And so in order to provide quality childcare, a quality childcare environment, it's not merely a matter of who you are as a person, who your staff may be, but on a material level, what resources do you have on site? What is going to be the differentiator between you and other providers? Is it going to be a downward race for prices? Hopefully not, because what you are providing, if people didn't know before, they sure as heck know now, is an invaluable service. Invaluable as it may be, it does have a fee. So you need to figure out these particulars, and you can do so with this tool. And I am just going to play it.
Calculator, which we'll refer to as the PCQC, is a free, publicly accessible, easy-to-use web-based tool that calculates the cost of quality for a child care center or a child.
And before I go further, I appreciate that because of the technical issue before, I am presenting to you through my phone. Can people hear the YouTube video that's playing right now? If you cannot, can you please just indicate in the chat for me? Okay, so I will assume that everybody can hear.
Their home. The intent of the PCQC is to help state policymakers and other stakeholders understand the costs associated with delivering high-quality child care. The tool can estimate revenues and expenses at different levels of quality and demonstrate whether there is a gap between the cost of providing quality care and the income or revenue a provider is able to earn. Knowing the size of that gap at different quality levels can help inform the design of policies, financial incentives, and supports for childcare providers. Over the next few minutes, you'll learn how to access resources to support your use of the PCQC and how to enter data. So let's get started. To access the PCQC, you'll go to the Childcare Technical Assistance Network website and click on the Provider Cost of Quality Calculator link. Once you've entered a username and password, you can begin using the tool. To save time, it's a good idea to use the data collection template to gather all of your state's unique information before you start entering data into the PCQC. You can see that these fields to the right show that, for some elements, default values are included. You can use these default values, which are based on national and state level data, or include data that more accurately represents the provider in your state. We recommend that you read the user guide before entering any data and refer to it frequently. It's accessible here under Resources and includes detailed instructions on using the PCQC. Once you've read the user guide and collected your data, you'll enter provider-level data in each of these tabs across the top for a center or a home. You'll notice that there's an expense and revenue statement at the top of every page. As you enter information into the tool, the expense and revenue statement is continuously updated to reflect these changes. You begin by selecting your state or territory and the descriptors for your state or territory's age group category. You'll then proceed to enter cost drivers for a center, including non-personnel and personnel cost drivers. On the next tab, you'll enter the cost drivers for a home. You can then begin entering the cost and revenue data related to higher levels of quality, including salaries, ratios, group size, and additional cost drivers. Each of these elements can be entered for each level of your state or territory's QRIS. You'll also enter information related to quality level for homes. Next, you'll enter reimbursement rates and tuition rates for homes and centers for each age level and QRIS level. And now you've arrived at the site profile page, the most exciting portion of the tool. At this point, you have just a few more fields to complete, and then you can easily change all of these elements to see how they affect net revenue. For example, the type of care, quality level, number of classrooms, percent of subsidy, and program efficiency. After you've created a scenario for a center or a home at different quality levels, you can create additional scenarios. Instead of starting from scratch, you can select Save As and retitle the scenario. As you create scenarios, you may find it useful to compare the data elements of each scenario. To do this, click on Download Results. You can view or print your scenarios here. This provides a good way to keep track of the data that you've entered for your scenarios. Additional resources on the PCQC are available under the Resources tab, including 2 issue briefs that provide examples of how specific cost drivers impact a provider's net revenue. If you have additional questions, you can email occqualitycenter@icfi.com. We hope.
Okay, so hopefully from that you could see the relevance of that tool. Let me just get back to my slide. So some of the things that you're going to want to focus in on if you use that slide or that tool include atypical cost considerations. So cost considerations that are brand new, which include which includes fluctuating, and in this case, increasing costs of cleaning supplies, pandemic insurance, and more. I want to just touch on, before going any further, on pandemic insurance. When we ran this series last time, I provided a couple of articles, one in particular about pandemic insurance and how Most people think, what do I need pandemic insurance for? I don't, because what are the odds I'm going to be in a pandemic? And then here everybody was in the midst of a pandemic. If you are still able to get some kind of insurance or rider that speaks to the impact of a pandemic on your business, and that may, as part of the insurance policy, do a payout to you if your revenues dip below a certain threshold, look into that. It can't hurt to look into it. It can only help. And some companies are still involved in selling those policies. Now, organizing your data and documents to comply with government COVID-19 directives and guidelines is this next, what I'm going to call mini section, because really throughout the entirety of this presentation, we're speaking with this in mind. And if you haven't really looked at these documents before, you want to look at them now, and that can be literally right now as I'm speaking, as well as after at a later time. So the New York Forward Safety Plan template really is the plan, the template of a plan in place that's going to help you navigate this period of time, this pandemic, as a business owner. So there are different areas of consideration in terms of people. So physical distancing, how you can ensure that employees comply with physical distancing requirements. You as the business owner agree to do X, Y, and Z. As I mentioned, if you are not very familiar with these criteria, you need to be immediately. Any business owner who has a brick and mortar certainly needs to be very familiar with these criteria, but certainly because you are in what many would call a higher risk field by virtue of the fact that you deal with and you work with the most precious among us, children, you're in a different category. So, it's broken down in terms of people, in terms of places, considerations of protective equipment. It's broken down in terms of hygiene and cleaning. And again, if you would like to be, a part of a webinar and service offerings that help you with understanding what cleaning products really are the ones that you probably should be getting, and how to source them efficiently, then please indicate so in the chat as well. Because as I'll mention towards the end of this presentation, there are certain products that the EPA, Environmental Protection Agency, lists on their website, in which, to my understanding, at least within my own school district, which is the Webster district, it does appear that there are some directives that are being issued with regard to types of hand sanitizers and types of cleaning solutions that personnel can use. So you want to look at this template long and hard, understand it, fill it out. You absolutely take pen to paper, so to speak, get a printed copy of this. And in the margins, right where if this applies to your business in perhaps unique ways based on the layout of your child care business. Are you in your home? Are you in a center-based daycare facility, et cetera? And of course, communication strategies. So to ensure the business and its employees comply with communication requirements, you agree that you will do the following. And you have to know what the following is. So, matters of signage, matters of communication plans for employees. And again, this is a perfect time to say, think about what can be digitized, what can be online, what can be done through text messaging, right? Standard messaging service. While you should always have an online and a paper, a hard copy backup, you want to make sure that if at no other time or no other, catalyst existed for you to digitize your things, then this is that time. So you want to make sure that you have a communication plan that perhaps is rooted in a service that really is for marketing, perhaps, where you can have automated flow of emails and of text messages based on whatever the need is. All right, now you need to know, even though we know that you are not teachers, right? You are not teaching in a school. You need to know what the New York State Education Department reopening schools guidance looks like, and looks like up close and personal, as so many people have done over the past couple of weeks and are continuing to do so, in greater relief. So going to NYSED's website is going to be the start. And again, the context here is twofold. One, you're going to want to know what the state is directing school districts throughout the state to do and to accomplish, and how they are framing what needs to be done. You're doing this not only just because it's good information to have, just because, right? It's not an academic exercise. You're doing this because the types of language the state uses, the types of directives it will give based on the different agencies that this information is coming from, in this case it's NYSED, it will give you a hint into what types of directives you may be subject to down the road should the need for more scrutiny and guidance become apparent. Again, and the backdrop of all this, or the background, is the fact that we are going into the second part, to use that term, of this pandemic in terms of chronology, but also flu season. So you're going to need to know what the protocol is for schools, because in the event that a school has to close, where do you fit in? What is the need going to be? Most likely, most definitely heightened for families. But where do you fit in? And what are you going to need to do based on whatever prescriptions there are? So that's the importance of that document. And I have a document that I'm sharing that has my, thankfully for you, not scribbled notes, but my Google Docs, margin notes and comments. So data. Again, this is to help you, inform you, and help you better serve. So questions that always need to be front of mind each day. Has anyone within your operation contracted COVID-19? For those who have, who and with whom did they have contact? How many? Were they symptomatic? How long were they sick? What types of processes were in place to reduce spread of the disease? So interestingly enough, people are increasingly finding that they have it and they're asymptomatic, right? But the best you can do really is what is reasonable. You can't, there's no oracle that you can speak with to let you know if you or somebody you work with or are caring for is asymptomatic and they actually have it. The best you can do is read up on the running tally, so to speak, of the symptoms of COVID, of coronavirus, and the symptom presentation. I will tell you, and I will share with you a document that will be released when you get the email from this, from the follow-up of this, that symptom presentation is already presenting itself to be different according to background. So, for instance, coloring of certain rashes that was found, or that's been found in the condition that's been really a complication in juvenile cases of COVID, looks differently based on skin tone. So you may be looking for something that may, be one color for a child who is Caucasian or fair-skinned, that looks completely different in a child who, has a darker complexion. So understanding those nuances and keeping a record of these differences to help not only guide you as the owner of your business, but guide your staff. So customer or client and employee perspectives, pulse surveys are powerful. If you're not aware of what a pulse survey is, it's pretty much just like a pulse. It's quick. It's really quick. It's not, a long drawn out survey to populate a graduate school dissertation with. It's a very quick, maybe 1 to 3 question survey to see how people are feeling, see what people are thinking based on whatever group you're interested in learning about. That could be your clients, could be your employees. So they're powerful. They can help you better innovate solutions to issues they or you may be having. So are tensions high for some reason? Are people, feeling as if schools may shut down for some reason? What impact does that have on your operations, and how can you get ahead of it? The best way to get ahead of it is to really look at how people are thinking, really, and feeling continuously, so that you can get insights into when things may be turning into an issue. Okay. Now, in terms of feedback, I'll just read this one quote from a parent who had been surveyed and interviewed. The parent said, "My biggest concern at this time is that my youngest is at an age where he is developing vocabulary speech. During this time in development, it is important for babies to see facial extensions, and I think facial expressions, and watch the way words are made with one's mouth so they can mimic those words and practice word development. If he is around childcare workers for 6 to 8 hours a day who are wearing masks, he will be at a disadvantage in this important time in his development. Wearing masks with clear shields would allow kids to see their caretaker's mouth and facial expressions." So again, this type of information would be solicited, would be found or obtained from a couple of places. One, the needs assessment that you are advised to provide, as well as the pulse surveys. So on, at the ground level, or at the high level rather, everybody is talking about, okay, masks and who needs to wear masks, and, what impact may masks have, at least in this person's eyes, on developmental considerations of can the child actually see your mouth move and form, certain words and certain phrases, etc. And you can see right here that something that could differentiate you from other childcare providers is provided to you right from the mouth of a parent, of a customer, of a client, which is the suggestion of, clear shields. So there are now these options where, especially for people who, for instance, are deaf, they can obviously have a better experience trying to read lips, if needed, than if you have a regular standard mask. So something to consider. Another parent said, whether adults will consistently wear masks, take time off if feeling sick, and limit unnecessary contact with each other and children. So this is short and sweet, but it's important in terms of organizing what your processes and protocols are in terms of the sick component. Take time if feeling sick. So do you already have, in whatever papers or online records you have, do you have a process in place so that employees know if they're feeling sick, where they can get support? You do not want to be in a position where a provider that you've hired feels trapped or has their back so far up against the wall that they try to minimize or mitigate or hide any symptoms. Because even if their symptoms are not indicative of COVID, if say they just have allergies or something else, you also have to think about look of impropriety and the optics. So are you organizing your information that includes things like a decision tree or a survey, as well as a list of resources that your employees can turn to, and they feel safe doing so that they can get their physical needs met, their health needs met in a manner that preserves their health, your client's family's health, and your business all in one shot. A third parent said, communicate open, honestly, and early. The way they currently alert us to instances of communicable disease is very disalarming. They post a sign on the door and a checkbox next to what disease a child in the classroom had or may have exposed others to. I'd like a text alert through an app just like they do for other announcements. So here you can get the sense of, okay, consistency is important. So if you're already using software or an app for one need, see if there are ways you can integrate text alerts, text services with either what you're using now, or if you can migrate over into something that has an integrative and holistic approach to providing several services to communicate with the families that you're serving. And COVID testing sites. I'm not going to go here, but when you get this through email, you can just click on this and you'll be able to get COVID testing sites throughout the country based on your state, county, municipality. So how to stay apprised of regulatory and compliance updates and issues. Finding information on your own, the reality of it is that it's difficult. It can be a long, drawn-out process. And when you already feel like you may be overextended, how do you make the process more efficient, simpler, so that it's a win-win for everybody? For one, I'm strongly encouraging you to set up alerts through Google Alerts. You can source news and better understand events and trends within not only the childcare industry, but also relevant industries. And you can get regular information on stories and topics that matter to you and your business. So for instance, the terms that I've laid out here include childcare, babysitting, criminal background checks, childcare regulations, economic outlook. COVID, of course, is going to be front of mind for a long time, but as I mentioned, the go-to that I go to for those types of alerts, in addition to just being from the Monroe County Public Health Department, because I reside in Monroe County, is to look at the automated email from Johns Hopkins. The Google Alert is helpful. Okay, and in the interest of time, I'm going to breeze through this, but again, you can just type in right now on your computer if you'd like to, Google Alerts, just to see. The National Database of Childcare Licensing Regulations. This is a tool for finding and searching state and territory licensing regulations and agency contact information. So there is a ton going on right now, as if you needed that reminder. But included in all that's going on in terms of public health considerations, we have an election year, et cetera, on a daily basis, whether any given legislature is in session currently, there are always in some shape, way, or form proposals being conceived, being worked out, stakeholder meetings happening regarding legislation. So you want to be aware of what's going on, especially as it pertains to your field, your industry, right? And so this is a resource that you can use to find precisely that information, as well as the contact information of relevant agencies to get one-on-one information. The National Conference of State Legislatures, through which you can get information on new, repealed, and amended legislation relevant to a number of topics, but in this case, childcare is also useful. Both of these tools are at no cost, they're free. Some of the childcare industry relevant issues include child fatality, near fatality, child protection in general, child sex trafficking and exploitation, prevention and treatment of abuse and training, reporting of child abuse or neglect, and shaken baby syndrome prevention. So all of these topics are always timely, but some perhaps are more timely than others because, and it's been reported on extensively, because of the school closures. One of the unintended consequences, yet a horrible reality, is that children aren't able to be in an environment where they would typically have access to more mandated reporters, to use that term. And so instances of abuse, neglect, sex abuse, et cetera, it's not as easy to get those reports in. So these are resources to stay on top of the legislative component, the information in terms of, okay, you know that things are fast moving. What do you as a child care provider either need to do now, or what legislation is gaining steam and going through the legislative process and likely to be enacted, passed, and then implemented, and what you need to do to comply with it. The Federal Register. If you ask me what I recall from, I think maybe my second political science course, sophomore year of college, a number of years ago, I would have said not much except for the Federal Register. It has been around many years. It is incredibly helpful, incredibly valuable. You can use it to gain an understanding of what relevant bills are up for comment by the public prior to their possible passage and implementation at the federal level. So there are a number of pieces of legislation that go through consideration every, pretty much every single day, all the time. You could use the Federal Register to do a more targeted search about childcare to see if there are any laws or any bills that may become law that would perhaps negatively impact you. If you find such bills, you can then comment on it, and those comments are actually reviewed and considered by elected officials. It may at times seem like we don't have a voice, but we in fact do, and the Federal Register is one of the most direct ways to have your voice as a provider heard. And I will tell you that because so relatively few people actually know about the register and use it, you may also, depending on how engaged you are with it, absolutely start to get what we call name brand recognition by certain elected officials who will recognize, okay, this is such and such from this child care business. She's commented before, and these are her comments, and she has a really good idea here and there. And again, this is to get you in the process of thinking not only about the constraints that admittedly exist right now, but the wealth of opportunities to really do better, including to bring together into the fold for you and your business stakeholders. Organizing your COVID-19 operations and public health checklist. So there are operations checklists, excuse me, and public health checklists. You can go to sites such as, for instance, Childcare Aware, which is a national organization, to see the types of checklists that they have available. You can not only use this for yourself, but you could also use it to actually provide it if you wanted, or a link to it on your website. So parents know that you are forthright in saying, here are these resources. Hold me accountable. Go through this checklist and see that I pass with flying colors. I have nothing to hide, especially during this uncertain and stressful time in your life. Take me to task and see everything that I am doing to ensure that I am providing the best care possible for your child or your children. So that's a resource, that's a checklist that you can consult. The family child care checklist as well, they have different tweaks for these checklists based on whether you're a center-based or in-home provider. Public health checklist, there's a list that will, advise you as to how best to clean and disinfect toys, especially baby toys, because we all know that as absolutely precious and adorable babies are, they are slobber little factories. And so during normal times, to use that term, while that may be a bit of a mess, it wasn't potentially a risk to one's health, not in the same way that it is today. So you can review peer-reviewed literature, so to speak, in such a case, and this is one instance of a medical doctor and obstetrician and gynecologist who's reported on how best to wash and to disinfect and sanitize those types of products. And then there are other checklists and reading that you can immerse yourself in this case, coming from the state of New York. 9 times out of 10, if you have a question about what you need to do, what you think you cannot do, the state has already figured it out. So don't be afraid to go to the state's website and to dig into what agency is most appropriate. If you do not know what agency you really need to look up the information for or through, feel free to send an email out to us. I provide my information at the end of this, and you can also reach out to Passstone if you, for some reason, can't find mine, and they will reach out to me. So don't be afraid to, consult the information that the state of New York provides, or whatever state you are in. So a few community resources to zero in on. Passstone, right? That name should not be a surprise or a shock. So Passstone has a wealth of resources. They are a lender, and they also are really an educator. They provide technical assistance and education programming, such as this webinar series, to help small business owners better navigate entrepreneurship and the challenges that come their way, including living as we now are in a pandemic. And so Passstone, you can reach out to them. I have provided their link right here, but you also have the information from the email tied to your registering for this webinar. The RIT Center for Urban Entrepreneurship, which is also known in the more abbreviated and affectionate form of Q, or the Q. You can reach out to them. They are a partner organization. They provide small business owners and entrepreneurs with high impact resources, connections to funders and other service providers, and assistance with crafting business plans. So to put 2 and 2, hopefully you remember that short video about the quality, childcare, cost of quality childcare calculator. You can use that as you sit down for a meeting, with Sylvia Okoye, who's the program manager at Q, and who can help you put together or improve upon your business plan so that you can apply for funding, whether that's a grant or a loan, so that you can shore up your resources to get whatever it is that you need, especially as we approach the fall, and that could include cleaning supplies, new furniture, etc. The Small Business Administration, which is a federal agency that is decentralized in the sense that they have many branches at the local level. You can go to them for counseling, capital, and contracting expertise. Five Star Bank, our sponsor, and Five Star Bank, can provide information and products and offerings along the lines of banking, not only for business, but for personal banking, as well as insurance. And Promise Venture Studio. Promise Venture Studio is really interesting. They are a nonprofit venture studio that, as they put it, attracts, supports, and connects promising entrepreneurial talent, capital, and there's that word again, stakeholders, to pave the way for the sustainable growth and impact of social entrepreneurship and early childhood development. So, if nothing else, I want you to view each and every one of yourselves as innovators. Yes, thank you. Nexus I-90 also just launched, I believe, last week, and that is a portal to resources. If nothing else, I want you to think of yourself as innovators, and you are perhaps innovators not by design, but by circumstance. By virtue of the fact that we are living now, we are one of the few generations in human history that is living through a pandemic. So with all of the challenges that I've mentioned throughout this webinar so far, there's a ton of challenges, of course, but there's a ton of opportunities. Think of all of the so-called crazy ideas you have, like perhaps you were too scared to share with somebody, and actually share it with somebody you trust and work on them and see what actually works based on the information that you gather from your voice of the customer, from your needs assessment, and from speaking to your current client families and prospective client families. Okay. I also want to mention to you some additional resources, including Facebook for Business. Facebook has amassed over the years a wealth of data that will help you really understand user behavior as amassed by Facebook to understand, okay, well, what if you're going to be running any type of ads on Facebook, what are the best times to do it? What types of customer personas or profiles work best with what you're trying to achieve with your business? So if you find, as I mentioned before, and this comes from the needs assessment, that you've got a ton of people, a ton of parents who work, non-standard business hours, who work non-standard business hour shifts, how can you use that information? How can you use the information that Facebook has to figure out a better way to target your ads so that you get either more leads to your website, or so that you could figure out offerings that speak to the unique needs of people who don't work during the standard business day? What does that look like? Child Aware of America is the resource that also had a couple of those checklists. The Environmental Protection Agency, as I mentioned, the Environmental Protection Agency is often an underutilized resource for child care providers, but they provide a wealth of information, training, and webinars on topics relevant to your nature, to your line of work, such as maintaining health and safe environments. So they are getting perhaps their shine now more so than in the last 20 plus years. But you can look at their website as well as Asthma Friendly Childcare, which is actually a site from the Illinois Department of Public Health, to see, okay, I know that I'm going to have to, put certain measures in place to improve on cleaning and sanitizing and disinfecting. Are there any products I should know about that are harmful that I should stop using? Are there any products that I should know about that are particularly good, that has been shown in whatever limited, empirical studies are better at removing, COVID? What do those look like? You could find that information on the EPA's site. And especially that information is useful because if you find as a provider that you are going to be prohibited from using certain cleaning products, for whatever reason, you're going to want to know that sooner rather than later. Early Childhood Learning and Knowledge Center. They offer tips, research, and guidance for child care providers, especially those seeking to be better attuned to families' needs. So again, going back to the beginning and throughout this arc or theme of needs assessment, understanding what families need, not only just in terms of, I need somebody to care for my child so I can work or so I can do this, but this is the type of assistance that I need based on what my child is going through or what, we may have gone through over the last 4 months or so. New York State Division of Child Care Services Information for Child Care Providers site. They have a guide to help providers with accessing general info, training, policies, cost-saving opportunities, and more. And at the end of this, I want to advise you of a service really that we've been at Architect testing based on demand from families. It's a service called Advent, and really it's a matchmaking service that matches families with education clusters or pods. So the problem in its most acute form that working families, working parents, including myself, are dealing with today is that we need affordable and trustworthy help to meet our new education responsibilities while also continuing to preserve and nurture our careers. So while many of us, with the state's authorization, are going to be sending our children to school in some shape, way, or form, that may change It may look different depending on my needs, depending on other families' needs. And so for those who are relying either solely or primarily on e-learning or virtual instruction, or hybrid schooling, and in some cases homeschooling, what does that look like, and how can I help myself, and how can I help other families? So what we're doing is we are putting forth, for those who are interested, a tech-enabled service that matches working parents with other parents, childcare providers like you all, and early childhood education specialists such as teachers or tutors, or college and graduate students studying relevant fields of study, to make homeschooling and hybrid schooling work for children and careers. And what this looks like is that we match families to other families that would gel, so to speak, along certain dimensions. And then we serve as the executor of the education cluster logistics, so it's a pod. So each cluster looks like no more than 10 children, a rotating co-lead parent or relative, a co-lead childcare provider, and a co-lead early childhood education specialist. So if you are interested in that opportunity, you are encouraged to go to adventfamilies.com. You could go through the entire site and then go to the site that's specific to early childhood education specialists and childcare providers, and submit an interest to apply. As we all know, we're still getting directives from the state, and right now with a hyper focus on our individual local departments of public health to see, okay, what are schools going to have to do with regard to the nitty gritty of daily testing if needed, or contact tracing, things like that. So that is what I have for you today. We have 6 minutes remaining before the official end of this webinar. I am happy to answer any questions you may have. I am happy to provide any resources that you may want. And please feel free to indicate if you have any questions at this time.
Hey, Yasmin?
Yes.
Yeah, so I definitely think this would be the perfect time, if it feels okay if I could just do, is it okay if I do my thing right now to ask someone a question? If this is all right.
Oh, sure.
All right, cool. I just want to make sure. Hey guys, I'm with Spectrum News in Rochester. I was actually interviewed Yasmin earlier, did a one-on-one interview with her. And I'm kind of doing a story today in reference to what she's talking about as far as, child care centers reopening. And I've definitely talked to her, talked to Yasmin, and got some information. I did want to, I guess, ask like one person or who was from a child care service, just a question or two, just that I could add for my story. Is there anyone here that's from a child care service who attended the webinar?
So I'm not sure who's left on the call, or if folks are having issues with their mics, but I do know that Tiffany, who has dropped off,
Okay.
unfortunately, but she was on the call. She was the first person to join the call, and she was telling us a little bit about her childcare business. I don't know if you were listening in at that point. She said she used to be able to offer 3 shifts. She has an in-home center. She used to be able to offer 3 shifts, and now she has had to reduce that number to just 1 shift, and she can only accommodate 16 children in that 1 shift due to COVID-19.
Yeah, I did hear her. She would have been the perfect person to ask a question. Was anyone else on the call? Just literally just wanted you, if somebody was like a child care provider or a parent, someone, just so I can like ask a question, so I can have something for my story. Is there anyone else?
It seems like Nicole came off mute. Nicole? Nope, she went. Patricia? Nicole? I think Nicole is having some
Okay.
tech issues. Is it possible for you to follow up with someone directly after the call?
Yeah, I can. It just is somebody, because pretty much, yeah, because I had to put this on tonight. So yeah, just I thought it'd be best to do it like right at the very tail end. So I wasn't sure because what I wanted to, because we're all on Zoom. So what I wanted to do was kind of record, them while on Zoom, just saying, hey, I learned this.
Right.
So
I wonder if Nicole could send you a private message
okay.
with her contact information. Nicole,
Yeah,
I think you're trying to, I think you're probably speaking, but we cannot hear you.
yeah. I'm typing something now,
Okay, great.
and the
And I see something is going on with Patricia's video.
Okay.
yeah.
And I'll see if I can get a hold of Tiffany for you.
Yeah, if you wouldn't mind, appreciate. Yeah, literally, I could just do like a recorded phone interview. It would only take literally 5 minutes. So if you wouldn't mind getting in contact with Tiffany, like I said, that's my number there. If you could tell her to call me, that way it would be great. That way I could just add it to the story. So that way I can, because what I want to do is get a perspective of someone, who has a childcare service who learned something from the webinar. So that's what I wanted.
Absolutely, I understand. Okay.
All right. Well, at this point, it is 1:29, but since it's a lovely day, we'll bow out a minute early. Thanks for tuning in, and hopefully we will see you in a couple of weeks. All right. Everybody have a wonderful rest of your weekend.
Just a reminder, the next webinar is on August 22nd. We are skipping next week, Saturday, and we'll be back here, same time, same place, August 22nd. Thanks, everyone. Have a good Saturday.
Thank you.